Says it's delaying its decision to allow Moderna to distribute its vaccine to kids between the ages of 12 and 17 because it's investigating a risk of heart inflammation that has been linked to people who received the Moderna vaccine. Now, while the side effect is rare, officials say it is more commonly seen in young men and boys. Meantime, Pfizer's COVID-19 vaccine could soon start going into the arms of kids between the ages of 5 and 11. An advisory committee with the Centers for Disease Control will meet tomorrow to potentially approve it. The FDA has already given it the green light. And joining us right now to talk more about it is Dr. Oz. Good to see you, Doc. How are you?
Doing very well. Well, the FDA has approved the Pfizer vaccine for young children. The CDC, these are telling me, will approve it tomorrow. And the federal government has already arranged for about 15 million doses to ship this week. So the vaccine seems to be effective enough, at least for the panel, to unanimously believe it was worth offering to parents. I must say, on surveys of parents, the reception is not as tepid. About a third of parents say we really want this vaccine now. We have a pre-existing condition with our kid. The kid lives at home with grandma, whatever the issue is, that once they want the vaccine. About a third of parents say we're going to wait and see because there's only a few thousand kids in this trial. Let's see what happens when a few million have been vaccinated. And there's about a third who say we're not going to take this vaccine because our kids already had COVID or we don't think they're at risk, so we're not going to go through with it.
So we're also talking, of course, about we're stepping into flu season, right? So it's also one of those things like, gosh, do you feel like maybe we're getting into shot overload for some kids?
Well, that's the belief of a lot of parents. I don't blame them. It's not like when I was a kid anyway, when you basically got 10 shots your entire childhood. Now it's 30 plus shots. And the COVID and influenza shots are annual shots. And so parents are saying, do I really have to do all these things to my kids? Is some benefit of them building up their natural immune system, especially when they're not hurt as badly as adults, thankfully, with COVID. And if you look at the worst complication rates, which are death, the risk of influenza and COVID are pretty similar. You don't want either one, but they're both, relatively uncommon. So parents understandably will say, well, but what about this myocarditis you mentioned earlier, which is holding up the Moderna approval? If kids get inflammation of their heart, shouldn't that be a reason for us to slow pedal this? I want to assure the parents watching that the trial was a small trial for the young ones. That's going to result in the approval this week. But younger children don't seem to get myocarditis that often. It's the teens and young adults, especially men, who are more at risk of this. It's about 1 in 5,000 cases. I actually know someone personally who had a child with myocarditis, and it's been a bit of a hassle.
Well, Doc, I want to go back to early on in the pandemic. Remember, where kids weren't getting COVID at all. It was mostly older Americans, and then all of a sudden the Delta variant came out, and we started seeing more kids getting it. But I think a lot of parents are going to say, well, let me weigh the risk, right? The risk of getting the shot versus the risk of, how sick is my child going to get if they do contract COVID? And then, of course, you add in the factor that COVID numbers are dropping rapidly, especially here in Florida.
Well, Florida's a good example. Since the weather's more hospitable outdoors, you're not going to be indoors with air conditioning. Therefore, the virus won't spread as quickly. And so you have another season of relative safety. 90% reduction of symptoms is what the vaccine is offering for young children. But if the young children don't have symptoms to begin with, do you really care? And any small complication will be too much in a setting where, of the 50 million children in America, very few are going to have major issues. But there are some exceptions. There are some parents who have very good reasons to be worried about their kids because there's a pre-existing condition. There's some families who just cannot afford to have COVID in their household. Let's say they got someone there who just can't afford to catch it, who's older. So there's good reasons to have this vaccine. And interestingly, I've been interviewing Paul Offit, who was on the FDA panel that just gave the go-ahead for this. And he's pretty sanguine about this. He's an experienced pediatrician. He says, some parents want it more than others, which is okay.
Yeah, I think everybody has to just kind of weigh it for themselves and decide what's best for them and their child. Always great to talk to you, Dr. Oz. Thanks. We look forward to seeing your show later today.
God bless. Take care.
You too. Thank you. And you can watch the Dr. Oz show weekdays at 2 o'clock right here on Fox 35. We're coming up on Good Day Orlando. Travelers